Uh, Apologies. If we can please go back one slide. Our topic for discussion today is going to be leading healthcare workforce transformation. Let's go ahead and go to the second slide now. I'm Shamsah, and I am the leader and the CEO of Health Tech Academy. I have over 20 years of experience, predominantly in education and tech or ed tech, in various different verticals such as healthcare, real estate, hospitality, across many different organizations. Some of the topics that we're going to be talking about today are going to cover the broad allied healthcare career opportunities, starting with understanding allied healthcare, exploring some of those options, and then talking a little bit about the trainings and certifications that go along with that. Let's go ahead and go to the next slide. A little bit about HTA, or Health Tech Academy. Health Tech Academy has been around for a few years already. We have a large number of students. Our goal really is to work with individuals that are interested in either moving into the healthcare industry, or they are in the healthcare industry and they want to gain additional skills and knowledge and find various different opportunities. So we're really redefining career pathways and really working with individuals that want to transform their lives, and they want to go into perhaps a different segment in the healthcare industry and workforce. And that's something that we're going to be covering in a lot of detail today, along with curriculum and a little bit more about what those opportunities really look like as we progress further and further in the healthcare vertical. And our speaker today is going to be Karla Coleman. Karla currently is the National Director of Workforce Development at Health Tech Academy. She has over 2 decades of experience within workforce development, career-focused training. She has countless years of experience working with different workforce boards, individuals. She definitely is a great collaborator, a great leader, and is really redefining our approach and how we want to go to market within the workforce segment. So Karla, thank you so much for taking the time and presenting with us today. I will hand this over to you.
Well, good afternoon, everyone. I'm so excited and happy to have you here with us today, and want to talk a little bit about who we are, our affiliations, and our partners. So we've been in business for quite some time as a whole, but as Shamsah mentioned, the Health Tech Academy side has only been in existence for a few years now, but we're based out of Austin, Texas, and we work with all the workforce offices and nonprofits across the country that are willing to partner with us. So a lot of great opportunities in allied healthcare. And one of the things that is incredible is the shortage in allied healthcare. I work with so many states, and the story is the same everywhere you go. There are a lack of qualified candidates. So one of the things that we want to focus on is helping recruiting in rural areas, and helping the retention for employers. And by doing this, we can help increase the longevity of a career with someone, instead of them jumping ship right away. If they're vested with an organization and the organization is vested with them, they're going to stay longer. So we're going to talk about all of the opportunities that are here in the allied healthcare field. Now, the nationwide demand for medical assistance is pretty staggering. As you can see, there are a numerous amount of openings, and this is a career where you can make a livable wage right out of training. And then as you stay with the company and continue to grow or stack certifications, your opportunities are really limitless. Now, with our medical assistant program, you would be getting your CCMA with NHA, which is for the Certified Medical Assistant Training. And then we also have our patient care technician training. Again, a great opportunity for someone who maybe has worked as a CNA before and want to move up, or for someone who just wants to go right into an entry-level position in allied healthcare where you're working on the patient care side. Again, great earning potential right out of training. And then, of course, you can continue to grow those opportunities by stacking credentials. And then we have surgical technologists. This is a wonderful field. Now, there are some prerequisites with surgical tech. We do want someone that has some allied healthcare background, but the opportunities are amazing. And as you can see, more than a livable wage nationwide. We offer dental assisting as well. And dental assisting is working with patients in the dental office. And again, large number of openings, and the entry-level salaries are pretty competitive. And then we have our pharmacy technician training. Now, pharmacy techs are in extreme demand. We actually have some employers that are wanting to run their own apprenticeships with us with the pharmacy tech program because they have such a difficult time finding qualified candidates. And the openings are, as you can see here, vast, and you can definitely make a good earning right out of your training. And then we have our medical billing and coding training. Now, medical billing and coding is awesome because you can work front office and sometimes back office. And the starting salary for the entry level certification is wonderful, as you can see here. And then as you work as a medical biller and coder for a year or two, you may want to get the higher credential, which is something that I definitely recommend for someone that's wanting to increase their earning potential. So this slide here shows you all of the programs that we have and some that are coming. As you can see, we will be adding healthcare IT, a phlebotomy technician, and sterile processing. We should have that by the end of fourth quarter. Really excited about that. And then we're going to also be offering our healthcare leadership certification, hopefully by Q1. Now, our boot camps are wonderful because you get a combination of, you can move at your own pace. I don't like to call them self-paced programs because we do want you to maintain a minimum of 16 to 20 hours per week in your training so that you can stay on track, get finished, and go right to work as quickly as possible. But we do allow you access to your training for a full 12 months. So if you need to go back and do more prepping prior to taking your certification exams, you'll have the ability to do that. And with all of our training, we do include the voucher for you to take your certification for your credential. And we have programs that range anywhere from 4 to 6 months. Again, I don't like that self-paced word, but you really can train at your own schedule. So if you work in the mornings, you can train at night, or if you want to train when the kids are sleeping, it's at your leisure. Now, we do require that our students check in with a live instructor 5 times throughout their training. And this is because we want to make sure that you truly have good comprehension on what's being covered in your training and that you're going to be prepared for that next step, which is getting that credential and then going to work. We do have career services to help you with all aspects of the job search. We do everything from helping you with that resume. We're also going to help you get your LinkedIn profile where it's very marketable and competitive. And then, of course, helping you land that job and your clinicals before the job, so that you can be very ready to go to work in your new career. Now, I did mention we do have the 5 on-demand coaching sessions. And what's wonderful about this is you get to schedule the time that works for your calendar with your coach or instructor. So you'll have a Calendly link and you can schedule the time that works for you. But there are the 5 mandatory check-ins as you're going through your program. In addition to that, we have our open office hours, and this takes place bi-weekly. And you'll be able to join the group, a collaborative group, and ask questions. And if you're not comfortable asking questions, you can listen to all the questions that everyone else answers. And that's always great because they may ask a question that you haven't even thought of. And then we have our Slack communication as well, and the student discussion board where you can collaborate with your classmates and ask questions, bounce ideas, and even plan your own study groups if you wish. Now, for our student resources and support, we have our online learning platform. With that, you do receive your ebook, the discussion forum. You're going to have your skills videos and procedure, and then you'll have your instant communication via Slack. Now, prior to you getting your voucher to take your certification exam, you do have to pass a practice exam first. So once you pass your practice exam, then you will be cleared to receive your voucher so that you could schedule your national certification. Now, again, we talked a little bit already about the career services side, but this gives you a little more detail about the resume building, interview prep, that profile building for your LinkedIn profile. And then you'll also have workplace essential skills, and you'll have continuous professional development as needed as you're going through with your career advisor. And then we have the externship support for your experimental learning. And this is not something that we do for you, but we assist you with doing this. And we've got some wonderful partnerships where our students can get their clinicals in, and you can also select your own clinical site, and then we of course would cover the insurance so that you can go ahead and do your clinicals for that employer, and hopefully they'll be ready to hire you if you do a good job. Now, I talked a little bit about those mandatory coaching sessions, and this here shows you a few of our coaches that you'll be working with. So if you're in a medical assistant program, you're going to be coaching with someone that has at least that medical assistant certification or even higher, because we want to make sure that you're going to really get that real life experience as well. You know, you're going to get that book work, but your coach can answer questions pertaining to things and even share information with you from their own experiences in the field. And again, you'll have their Calendly link so you can schedule a time that works for you. Now, we wanted to share a few of the Trustpilot testimonials of students and graduates that have completed our training or are going through our training. So here are a few of them, but we're also going to share a link with you that's going to give you a video of one of our graduates. And it's a wonderful video because she talks about her entire experience as she was going through the program, tells a little bit about her background with college and everything. So that will be coming to you in your post-webinar email from us. What we'd like for you to do now, if you're interested in learning more about Health Tech Academy and you would like for one of our admissions advisors to speak with you, you can scan this QR code here, and fill out some information, and then someone will be getting in touch with you probably within the next 24 hours. And I want to thank you so much for attending our webinar. At this time, we'd like to open up for any questions that you may have. And Shamsah will call on the individuals that have questions.
Yeah, absolutely. Thank you so much, Karla. That was fantastic and so informative. Definitely appreciate you going through that. We do have a few people that have raised their hands. So I'm going to call on the first person, who is Steve. Steve Tanner, I'm going to, you can go ahead and ask your question.
Not hearing
Hello.
you. Oh.
Good afternoon, everyone.
Good afternoon, Steve. We can hear you
Hey,
just fine.
I think I haven't raised the hand over there. I was just trying to unmute myself, and probably it shows the hand over there.
Okay.
But I do have a question about, like, I've been working under Danish, and we are just working on the externship requirements. And most of the state, they doesn't want the person to have the externship, but this is for their own career. You can say on job training process. So we do have to work on the externship things, because I did not find any state which has a requirement that the person who has been certified from us, they must have to.
I
Not hearing.
think, Steve, you might have
did we
either
lose him?
disconnected or accidentally muted, Steve.
I see a
It was
question.
Oh, there you
accidentally
go.
muted.
Oh, sorry. Oh,
I see a
Okay,
question here from Tiara Bryant. I can address that really quickly.
let's
Tiara
do that.
asked if there's any cost associated. Yes, there is. Our programs are only $3,450. If you are paying for the program on your own, the admissions advisors can share with you. We do have some ways that you can save money on your tuition, but we do offer payment plans if needed as well. And then for individuals who are either unemployed or underemployed, you may be able to qualify for funding through a workforce grant, which is the WIOA grant, which stands for Workforce Innovation and Opportunities Act. So Tiara, hopefully that answered your question. And
Thank you so much, Karla. We do have another question from Sierra Galman. So I'm going to go ahead and allow you to go ask your question as well. Sierra, please go ahead.
Good afternoon. How's everyone doing?
I'm doing
Great.
great. How are you?
That's great. I'm doing well. My name is Sierra. I recently just enrolled in a surgical tech program. I spoke with a gentleman named Anthony earlier today because I had some concerns when it came to locating a clinical site. So I work as a medical assistant and also a clinical supervisor. So I have experience in the medical field for almost 10 years now. However, I do know that some hospitals do not feel comfortable allowing outside people in their OR, regardless if they have their NCCT ID or not. So Anthony did mention that you guys do not locate the clinical site for us, but you do help us find it. So he did mention that I could supply him with a list of hospitals and he will call around to see which hospital will accept me and will allow me to do the externship. So my question is, if I'm not allowed to do the externship at any of the hospitals that was provided to him, what would be the next alternative?
At this particular point in time, the range of our support, Sierra, is within, where you're located, or if you're looking to make a move into a different state or a different vicinity where those externships are going to be provided. There are a large number of students we work with, and a large number of hospitals or clinics that also want to partner with Health Tech Academy. So far, to my knowledge, nobody has come forth and said that they will not accept a student that we already have a partnership with.
Okay, so my next question is, are you guys partnerships with any hospitals in the state of Maryland? Because when I spoke to Anthony, he did mention that you guys are located in Texas and you are partnership with some locations in Texas, but he didn't mention any of them in the state of Maryland, which is the state I'm currently in.
Which is the state you're currently in. Yeah, I can definitely look into this with you, Sierra.
Okay.
Or for you rather. I have your name and your information right here as far as your first and last name. And then since you're an enrolled student, we can connect with you and tell you the options that we have available in that particular state. That work?
Okay.
Awesome.
Yes, that
Yeah.
definitely will work. Yes.
Great. Karla, we do have some follow-up questions in chat from Tiara
Okay.
Klein. With one is, how do you apply for WIOA? Sure, go ahead, please.
So, Tiara, if you would like to apply for WIOA, we would need to know a couple things from you to assist you. And if you fill out that form, we can definitely get that process started, but we need to know what state you live in and then also the county or zip code. So go ahead and fill out that form and we actually will walk you through that process. It's not very difficult. Depending on where you live, what state, the process can take longer in some states than others. You know, we have some states that move very quickly. So I like to give a range, usually from the time that you apply for the funding. It may take anywhere from 4 to 8 weeks to get approved. And when I say approved, that means where you've received the approval from the workforce office via an ITA or voucher. And at that time is when we would be able to get you enrolled and started in your program. But again, we assist you through the entire process and we even help with the follow-up with the workforce office for you so that you don't slip through the cracks.
Tara, if you have any further questions, please let us know.
Okay.
But I think she did mention that she's in Cook County, Illinois.
You're in Illinois. So yes, fill out that form and we will have Sharami get in touch with you because we do a lot of business in Illinois and we'll be able to assist you.
Great.
Looks like
There
all
is a coach. Sorry, one more question, Karla. Somebody has their hand up. It is Deala Wilson. I'm going to go ahead and my apologies if I said your name wrong. I'm going to go ahead and
Hi, yeah, my name is Dayla Wilson. Nice to meet you guys. I'm also looking for a internship opportunity. I live in Cleveland, Ohio. I've enrolled in the program about 2 months ago, and I am willing to relocate, perhaps, if there's no work here.
What program are you?
Oh yeah, I'm in the surgical tech program. Sorry about that.
Okay.
Yeah, I'm in a surgical tech program, and I've just been looking at like Cleveland Clinic, University Hospital, Metro. That's what we have out here in Cleveland. And you do have to have your qualifications, of course, to even be in the OR, so no outsiders. And I just want to look for potentially getting a job, because I will be done with my program shortly. And
yeah, absolutely. For any individuals that are interested in finding out more about how to go about externships or helping, asking for assistance there, the best thing would be, Karla, if you don't mind putting up the QR code again, please go ahead and fill that out, and we will have our support and career services team reach out and work with you on finding some organizations and local hospitals and clinics in your area that could support you further.
Please, when you give that information, note what state you're in. That would be very helpful.
Great call out there, Karla. Absolutely.
Okay, there's a question from Farid Hamid. Oh, same. So Hamid, yes, please use the QR code.
And then yes, you can fill out the code right away. That's fine. I think we had a follow-up question there from another attendee. Any other questions? We're happy to take them over chat. We do have a question, Karla, and I can definitely take that as well. Do you have monthly installments to make it affordable to pay? We absolutely do. We have multiple ways in a student can pay. They can pay obviously all up front. Or we have a couple of financial partners that can pay, that they can work with and apply, and then go through the process. And then additionally, there are monthly installment payments that HTA offers as well. So with a down payment, and then the rest of it could be carried. Okay, looks like we have one more question. This is a no name, but if you're on an iPhone and you have your hand up, please go ahead.
Can I have a question?
Yes, please. Please go ahead.
Okay, my name is Amin Ali Kasam. I have a certificate from pharmacy technician. I did the course in around 2008 in New York, and I did the internship also. How would I start my work here? I'm in North Carolina right now.
Are your credentials current?
Excuse me, sorry?
Are your credentials current? Your certification?
No, I did in 2007. I don't know how it's gonna be still active or what.
I couldn't understand.
Yeah, so he said he didn't know if his credentials are active or not, and he did it in a different state altogether. In 2007, I believe is
Yeah,
what
7 or
yeah.
9 sometimes in New
7 or
York.
9, yeah, in New York, right? And now
Oh.
you're in North Carolina.
Yeah.
Yeah, so
yes, if you haven't kept up with your credentials, unfortunately you're going to have to start over in order to get recertified. But
Okay.
the good news is, because you've already been certified, it'll be review for you and you can get through the program rather quickly. But once you're certified, you want to make sure you do not let those certifications expire. You want to get renewed or do your continuing ed, whatever is required to remain in good standing.
Okay, but you know what? I asked a couple of pharmacy when I like a CVS or Walgreens. I just asked them I have a certificate from New York in 2007, 9, whatever. But they said, okay, yeah, you can apply here and you can work with us, and then you can learn gradually working. Is that
Well,
true?
I know that I've done partnership with CVS, and they will there are some CVS, it's not across the country, but there are some that will let you work like in the front of the pharmacy while you're doing their training program. But I will tell you, the income earning potential is not the same when you do that
Oh,
versus going through a nationally certified training.
I got
Because
you, man.
if you're going through their program, they're going to pay you less than someone who's nationally certified going to work.
All right, man, I got you. Thanks for helping.
Absolutely. Any other questions?
think we have one more,
Or-
Fareed.
Fareed?
Yes. Can I have a question, please?
Absolutely.
Yeah, thank you so much. I'm a doctor from my back home, Afghanistan. I've been here in USA since 1 year and a half. I have my diploma, my medical diploma from Afghanistan, and I have lots of certificates from there, and as well as my transcripts. If I apply for the surgical tech program here, as I had a question, also I write a chat in chat. So I'm living in Washington State, but I'm not sure about the externship here. Do you have any partnership with hospitals here? I have skills, I have knowledge and everything, but I need a certificate for start my job in surgical tech. And also my another question is, would my transcript or my diploma, if I evaluate it here, does it like help me in the program or no?
Well, definitely having the prior background will let you be admissible for the program because you've got a healthcare background already. In terms of transferring in credits, our program is not a for credit program, so that's not required. But one thing you may want to do if you haven't already is get your transcripts translated so that when you do start applying for work, if they want to see something more, you've got that.
That's great. And how about the externship here? Do you know hospitals, or do you have partnership with the hospitals here to accept the externship program there? I mean the clinical part.
As Shamsah said, every state we work with individuals. It's a one-on-one situation. So if you fill out the QR code, we can get someone that's working in Washington State for the clinical pieces to get in touch with you and be able to answer that question. But I will say that we do have a partnership with an organization that does a lot on the East Coast. So I will say there's definitely a resource there, and our students all will have access to that resource. But again, filling out that QR code is the best way to get your answers to your questions totally.
Okay, so
Sorry
after
for
like filling the QR code here, is it possible to like let us know before starting the program to know that or to make sure that here is some hospitals that accept our externship, and then it makes sense to like start the program. But if we start the program and at the end like tell us there is no externship or no hospital is accepting your externship here, so that I think at the end of the program it doesn't make sense. So before of that, is it
Fareed.
possible to give us any information prior to starting the program, please?
Fareed, if I can just reiterate, one of the things that it's a two-way street. We assist our students with finding those externships. So we are diligently building partnerships. We've got someone that's on staff, that's all they do. And so we've got partnerships there. I can't speak to where they're at or who they're with, but filling out that QR code will be able to get you more answers. I don't,
Okay, thank
I
you
don't
so
know if
much.
Shamsah wants to add anything to that.
No, I think that's perfect. I think the first step really should be to please fill that out. An admissions rep will call you. They'll walk you through our process. They'll talk a little bit about our services and the support that we provide. And our goal really is to work with the students to ensure that they complete the course and they're also placed with their clinicals, etc. But as Karla mentioned, it is a two-way street. We provide the support and we work with the students as much as we possibly can to help them out.
Okay, thank you so much.
Any other questions?
Great. I don't see anything else in chat, and I don't see any hands raised either. So once again, oh, actually, I
Oh, we
did
have one
see,
more.
let me just move this student in. Go ahead, please. Dahlia.
Miss Wilson. Dyla Wilson. Oh, it's not letting her unmute. Shamsa, do you have the ability to unmute her?
Here,
I just helped you.
yeah, it just showed me. Thank you, Bob. Thank you for that. So this picture here on my screen, do I screenshot it or do
You
I
can
use
take your
the?
phone, your camera on your phone, and it should take you right to the form.
Oh, okay. Thank you.
You're welcome.
Absolutely. Well, thank you everyone for joining today. Once again, thank you so much, Karla, for your time. We definitely appreciate it. And thank you, and everybody have a wonderful weekend ahead.
Bye,
Bye-bye.
everyone.
Bye.
Oh, I see one more question, but I think it's too late, isn't it?